Welcome back to Inner Power Psychiatry. Today, I have a client here with his wife. I received a report that he was recently discharged from the emergency room, following a serious episode related to alcohol addiction and liver cirrhosis. He's here now, for a psychiatric evaluation. Let's see how I can help him.
Doctor, please help him. He just got out of the hospital after 3 days. They said if he keeps drinking, he'll die.
Mr. William, can you tell me what happened?
Yeah. I was drinking, and then suddenly, I guess I blacked out. Next thing I know, I wake up in the hospital. My wife called the ambulance. But hey, nothing to worry about. I'll be fine.
Babe, you have to be honest with Doctor. He is not fine at all. Since his mother passed away, he drank alcohol every day. He cried and stayed inside the room. He got fired from his job because of alcohol. Doctor, please help.
He was raised by a single mother. Poor, but loving. She was always there for him. She begged him not to be like his father, an alcoholic who was never around. On his wedding day, his mother whispered a final wish to his new bride.
Please, help him stop drinking.
Just days after the wedding, she passed away. A sudden heart attack. And with her, his hope began to fade.
I miss my mom. So much. She's gone. I wasn't her best. But she did everything for me. I don't know what to do from now on. I'm sorry, Mom. I'm so sorry.
Mr. William is battling alcohol addiction. But not only that, he's also carrying deep grief from the loss of his mother. Now, he's developed liver cirrhosis, and that's a serious, life-threatening condition. I need to act now. There's no time to wait. William's story is powerful, and sadly, not uncommon. Behind every addiction, there's often pain, trauma, and unspoken grief. In this next segment, let's take a closer look at what alcohol addiction really is, how it affects the body and mind, and most importantly, how it can be treated. We'll also explore how loved ones can offer support, and how healing is possible, even in the face of loss. Because recovery isn't just about stopping the alcohol, it's about finding your way back to yourself. So what is alcohol addiction? So, what is alcohol addiction? Alcohol addiction, also called alcohol use disorder, is a medical condition where a person can't control their drinking, even when it's harming their health, relationships, or daily life. It's more than just drinking too much. It's a chronic brain disease that changes how we think, feel, and cope with emotions. People with alcohol addiction may feel a strong craving to drink, struggle to cut down or stop, even when they try, keep drinking despite serious consequences, experience withdrawal symptoms like shaking, anxiety, or sweating when they stop. Alcohol addiction doesn't mean someone is weak or lazy. It means they need support, medical care, and compassion to recover. How alcohol destroy your body. So, how does alcohol affect the body? Alcohol may seem harmless at first, but over time, it can damage almost every major organ in the body. Brain. Alcohol changes the brain's chemistry. It affects judgment, memory, and mood, and long-term use can lead to depression, anxiety, and even brain shrinkage. Liver. The liver works hard to filter out toxins, but too much alcohol causes fat buildup, inflammation, and eventually cirrhosis, a deadly condition where liver tissue is permanently scarred. Heart. Drinking heavily raises your risk of high blood pressure, heart failure, and stroke. End stage of alcohol use disorder, liver cirrhosis. Liver cirrhosis is a condition where healthy liver tissue is replaced by scar tissue, slowly destroying the liver's ability to work properly. One of the leading causes of cirrhosis is chronic alcohol use. Every time the liver processes alcohol, some liver cells are damaged. Over years of heavy drinking, the damage becomes permanent. As more scar tissue builds up, blood can't flow freely through the liver. This leads to serious problems like swelling, internal bleeding, infections, and even liver cancer. Common signs of cirrhosis include a swollen abdomen, yellowing of the skin and eyes, and mental confusion. But there's hope. Stopping alcohol use can slow or even stop the progression of liver damage. The earlier you act, the better your chances of saving your liver. How to recover from grief and alcohol use disorder. In today's case, he is suffering from two major conditions: grief from the loss of his mother and alcohol use disorder. He drinks to numb his deep sadness, but alcohol is only masking the pain, not healing it. Recovering from alcohol use is critical for him, but it's not a simple solution. He struggles with poor coping skills and lacks healthy ways to manage his overwhelming emotions. Many people mistakenly believe that drinking is simply a weakness, and they often urge the person to just stop drinking. But in reality, alcohol dependence is a complex medical and psychological condition. In his case, healing his grief must come first. Psychotherapy, especially cognitive behavioral therapy, can help him process his loss, challenge the painful thoughts, and build emotional strength. And he doesn't have to fight alone. Attending Alcoholics Anonymous, AA, meetings can give him a powerful support system, people who understand his struggle, who listen without judgment, and who walk the path of recovery with him. At the same time, his alcohol recovery must be carefully managed. He needs weekly check-ins with his doctor, close monitoring of his liver function, and appropriate medications to support his withdrawal and prevent relapse. Today, Mr. William and his wife is here for 6-month follow-up. Hello, Mr. William, how are you today?
I am doing well. Doctor, I have not touched any alcohol for 6 months. I feel great. I have no desire to drink any alcohol at all. My wife helps me eating healthy. I also help other people in AA meeting to quit alcohol. I am very thankful to my wife, my doctors, and my therapist. I am also dealing with my grief. I am sad, but I am okay. I believe my mother is happy now because I stopped drinking alcohol. I hope my mom proud of me.
Mr. William is recovered from alcohol use disorder. He still continue work on his treatment, but I am sure that he can overcome his past and fully recover from his damage. Recovery from grief and addiction is a difficult journey, but no one has to walk it alone. If you know someone who is struggling, reach out with kindness, not judgment. Sometimes, your support can be the light they need to take the first step toward healing. Remember, recovery begins with hope, and hope begins with you. One step, one breath, one day at a time.